Welcome to Caring Through Cancer, a series by the Mary and John Elliot Charitable Foundation, bringing together voices of care who help to shape the cancer journey for patients of the Solinsky Center for Cancer Care at the Elliot. Thank you for joining us as we walk this path together, one compassionate conversation at a time. Today I'm with Dr. Brian Knab. Dr. Brian Knab is a radiation oncologist with Radiation Oncology Associates and serves as the medical director of radiation oncology at the Solinsky Center for Cancer Care at the Elliot. He has been a dedicated partner of the Elliot team since 2007. As a radiation oncologist, Dr. Knab oversees patients' radiation treatment plans from development through therapy implementation. In addition to his clinical duties, Dr. Knab also ensures to deeply connect with patients and their loved ones. Dr. Knab takes great pride in the mission of the Cancer Center by partaking in a multidisciplinary approach to cancer care and treating his patients with the utmost compassion and respect. Thank you for joining us, Dr. Knab.
Thanks for having me.
So, Dr. Knab, before we start talking about the Cancer Center, tell us a little bit about yourself. How did your journey through medical school, and what brought you into being a radiation oncologist?
Yeah, so I think for many physicians, we know pretty early on that we are interested in healthcare and interested in caring for others. I probably knew in ninth grade I wanted to be a physician. When I was in high school, I grew up in the Washington, D.C. area, and I had the opportunity to work at the NIH for a summer and had an opportunity to do medically inclined research. And that really just solidified for me my interest in medicine and integrating patient care and scientific discovery, which I think really is the heart of medicine. I went to the University of Virginia. I grew up again in the Washington, D.C. area, and my studies focused primarily on medically related subjects, and I also continued doing neuroscience research throughout my 4 years as an undergrad, which was an amazing experience as well. And then applied to medical school. And in medical school, the medical school where I went to, we do all of the classroom work and the clinical rotations in a period of 3 years instead of the standard 4 years. And so that leaves a year of research. So for my year of research, my fiance was in grad school at Berkeley, so I went out to the University of California, San Francisco, and did my year of research at the University of California, San Francisco. And I worked with a pediatric hematologist oncologist, which is what I went into medical school thinking that I wanted to do. I was interested in oncology care, and pediatric oncology is a really exciting field in the sense that if you look at the advancements that have been made in oncology care, many pediatric cancers are curable cancers and treatable cancers, and you make a tremendous impact in that patient population. So I had the opportunity to work in a lab with this amazing researcher. We were looking at novel therapeutics for a specific type of leukemia. And while I was in the lab, the physician I was working with really said, "You should look into radiation oncology." And so he had set up for me to shadow with two radiation oncologists who are considered to be really leaders in our field, one of which was Daphne Host-Kogan, who's now the chair of MGB, of the oncology program at MGB.
Wow.
So I had the opportunity to shadow in her clinic and was just really inspired. She is a pediatric oncologist, really inspired by what she did and her interactions with patients and families, and it was just really an eye-opening experience. What I really liked about radiation oncology is you have the opportunity to work with different populations. If many of us work with children, the majority of us work with adults, and we treat all different types of cancers with radiation, which is really what drew me to the field. Is it's you don't get pigeonholed into one specific field within oncology, but you have the opportunity to work at many different disease sites. So working with surgeons, working with medical oncologists, working with pathologists and radiologists, and then also all the other support services that go into oncology care with social work and physical medicine and rehab. And so it's the integration of all of these all these specialties that really drew me into the field. So I did my training at the University of Chicago in radiation oncology after doing several rotations in radiation oncology and realizing this is what I wanted to do, and had wonderful training there. At that time when I entered training, there was a huge change in how radiation oncology or how radiation is being delivered in terms of the technology. And I was really, when I started medical school, you saw kind of what we had been doing for the past 30 to 40 years. And then when I left my residency program, it was closer to where we are today in terms of the technology, the machines that we have, which is just was amazing.
I would imagine you've seen significant evolution.
Oh yeah, yeah. So it's I think that we really the people in my generation of when I trained, we went from where we saw like the old school machines and the old school treatment planning, which is great to have that background because it really gives you a good foundation in terms of anatomy and the basics of radiation oncology. But then being able to have the access to the technology, the machines, is just really phenomenal. What we've been able to partake during that relatively short period of time there's just a real explosion. And since I've left residency and been here, the technologies is continually to evolve. Yeah.
I know you've been an advocate with the Elliot Health System in looking at opportunities to advance cancer care and making sure that we have the right technologies to support some of the things that you've been able to deliver. So tell us a little bit about cancer care today and how you and the Elliot take a unique approach to cancer care with a compassion-first mindset.
Right. So a great question. So we always say that the patient and the family comes first. And when you've established that relationship with the patient, I think the most important thing is before you start talking about treatment options and approaches and kind of where, what's happened, what studies have been performed, is really to get to know the patient, to get to know the family. What are your children? What do you do for a living? Where do you live? Where are you from? What was your journey up to this point, to really get a sense of the individual, to understand where they're coming from, what their priorities are. And that's the number one thing that we do when we first meet a patient. And I'd say that's not only true for myself, but that's true for our entire team. So the nurses and the therapists that we work with take that exact same approach, is to know the individual first, and then we focus on the logistics of the cancer treatment.
Okay.
Yeah.
The Solinsky Center for Cancer Care takes a multidisciplinary approach, kind of what you were talking about a little bit there in terms of the different options and the connectivity. Tell us a little bit, how does that multidisciplinary approach impact the patient experience?
Right. That's a great question. So what a lot of patients don't realize, there's a lot of work that goes on behind the scenes before the physicians meet with the patients. So before the patients typically even are a treatment plan is outlined for the patient, we have what are called multidisciplinary tumor conferences or tumor boards. So you have medical oncologists, radiation oncologists, surgeons, radiologists, and pathologists, where we sit around a table, and every week and for each disease site, we present new individuals that have been diagnosed or are needing additional care, and we hash things out around that table. We decide, hey, what do we think is going to be the best treatment approach? And it's great to have everyone's input, so that you're not just having one physician say, "Oh, I think you're going to get this drug or you're going to get this treatment." We'd say, "Oh, well, what do we think about this?" Or, this study just came out last week. How are we going to integrate this into what we're doing here? And so I think it's really important for patients and their families to know that these decisions are being made as a group. And we also have the resources of the greater Boston area as well. So when we encounter a difficult situation, or a situation that might be a cancer that might not be a cancer that we see every day, it's great to know that we have these resources in the community around us to reach out to experts in the field and say, okay, what needs to be done here? What needs to be coordinated in terms of getting this patient the best care that they need? And so it's nice to know that all of that's happening even before the patient walks into the room to meet the physician. Just getting to that multidisciplinary approach.
Yeah, there's significant thought and coordination. And from a few of our prior episodes, we had the opportunity to connect with one of our nurse navigators.
Right.
And, she was kind of talking a little bit about those different disciplines, the connectivity, and how do we make sure that we structure our patients' care and provide a little bit of that guidance and that kind of. And it's just amazing the amount of work that's done for our patients that sometimes they don't see directly what's happening kind of behind the scenes, and then the support around them. Are the nurse navigators are something that I think the Elliot and the Solinsky Center for Cancer Care really pride themselves on as almost differentiating how we're able to deliver that care. How are the nurse navigators involved in some of your programming support? How do you connect with them?
So they're there from the get-go. So they're at those tumor boards. So they're there taking notes, helping to coordinate. A lot of that happens before the patient recognizes, they need to see this physician. The nurse navigator is helping to coordinate those appointments and making sure that if there are other services that need to be drawn in, that they're relaying that information to those other providers or to other individuals, and then coordinating that with the patient and their family. Because there's so many moving parts, and it gets to be overwhelming. Even from a physician standpoint, there's so many moving parts that you just need. You need that coordinator, if you will, to make sure that everything's happening. Those appointments are happening in the right sequence, and that patients aren't having to wait a tremendous amount of time. So if you know a patient's going to need a certain study, and you're not going to see that patient maybe for another week or two, you don't want to wait a week or two for you to even order that study. So a lot of that coordination of care is happening with the nurse navigators even before the patients arrive to clinic. So if there's additional studies or tests that need to be done, they help to coordinate that so that we're moving things along, that that there aren't these big gaps in treatment because there's just so many moving parts. Yeah.
So, I know we've talked about the focus on care being patient-centered and making sure that really the most important element of the care that we all are providing as a team really comes down to, are we doing right by the patient?
Correct.
And our nurse navigators have really been some of the glue that kind of helps.
Right.
We've seen that work. I would imagine, kind of like the technology has evolved, you've seen some of that evolution in terms of that support.
I think, when I started my training, I think there was a bit of the mentality of the physician knows best, and, the physician's going to dictate what plan's going to happen. And oftentimes that doesn't coordinate with the patients, with their priorities or what their focuses are. So I think the nurse navigators do a great job of that, getting to know the patients, even oftentimes, and saying, okay, this is what they're thinking, and this is what what their goals and what their priorities are, and really integrating that into the treatment plan so that you're not just having one individual saying, oh, well, this is how this is going to be, that we really are pulling families and patients in and making sure that we're doing right by them. Great. And that they're an integral part of that treatment plan. There are so many options available to us in oncology today, and the patients really have to be a part of that decision-making process. Because which is a great thing to have all these options available to us, but really to make sure that the patients say, okay, this is in alignment with my goals, or this is not in alignment with my goals. And sometimes it takes us working together for us to see each other, to eye to eye, to say, okay, I understand where you're coming from. And same is true for the patients to say, okay, I see the importance of that. I didn't understand that at first, but now that you've explained that, that makes sense. And I think the nurse navigators and the nurses that we use and the therapists really do a great job of trying to provide that information to patients. And then likewise, the nurse navigators also do a great job of bringing that information to us too and saying, okay, this is where the patient's coming from. This is what they've had. And, this is their understanding of the situation.
Does that make your job easier in terms of, or do you have more time to focus on, the critical decision making? And I've had the luxury of speaking to you previously and working with some of the folks in our cancer center, and just the amount of planning and the dosing and the understanding. How does that help you as a provider?
Definitely. So I think the number one priority is you want to give the highest quality of care, and you want to do it in a timely fashion. And so and what the nurse navigation component does, what these tumor boards do, and what the multidisciplinary approach does, is it allows us to continuously be moving forward. That you minimize roadblocks and you minimize dead ends in terms of making sure that we're always moving forward. And so I think what that allows us to do is to make patients feel confident in terms of the care that they're receiving, and recognizing that it's happening in a timely fashion, and that they're getting everything that they need is happening in a coordinated manner, and that they're not responsible for trying to find this physician to help with this and trying to find another physician. Nope, that's our job. We're going to take care of that. If you need something to be coordinated, that's what that's what we're here to do, and that's what
Great.
That's what the nurse navigators are great at doing.
Excellent.
Yeah.
So you've been with the Elliot or working within our structure since 2007.
Correct.
What brought you to New Hampshire?
So I'm originally from the East Coast. So when my wife and I, when we were trying to decide where we wanted to practice, we knew we wanted to be somewhere on the East Coast. So we looked everywhere from Maine down to Georgia. And when I interviewed with this practice, I was just tremendously impressed with the doctors that were here. Everyone was very well trained, extremely patient-centric in terms of doing what was right by the patient. And what impressed upon me is when you talk to the individuals that were here, is that the amount of autonomy that they were given to practice medicine, that there was, that there's no expectation that you have to treat a patient a certain way, or that you have to follow, these certain, restrictions, so to speak, that you're doing what's right by the patient, and that the hospital system is going to support you in doing that, which I think is huge. Because a lot of times you don't get that. You have, big hospital systems say we want something to be done in a certain way. Yeah. And I think the Elliots, their philosophy has always been, you do what's right for the patient and for you and the patient to make these decisions, and we're here to support you.
Great.
And I think that's really at the heart of what we do, and of the organization as a whole. Not just for cancer care, but I think as an organization as a whole.
I agree.
Yeah.
Yeah, I agree.
Yeah.
We've seen that in a lot of the development, particularly recently, as you see a lot of the growth for Elliot Health System.
Right.
I asked that question because you've seen some growth over, close to 20 years.
Correct.
And in some of the development, I know I was, as I started to learn a little bit more about the services, I was blown away by the fact that Elliot was relatively a pioneer in early utilization of radiation oncology and the delivery of that, and really almost a pioneer in getting the right equipment and technology. I'd be curious from your standpoint in terms of the tools that you need and the things to deliver the top-notch, cutting-edge services. What are some of the things that you think are unique about the Solinsky Center for Cancer Care and the technologies and the opportunity to deliver care locally? Yeah.
So I think it's great. We do need to go back to our roots in terms of our cancer program is well over 75 years old. When you look back at the history, it's a very rich history. We were one of the first cancer programs in the country to have a linear accelerator. So a linear accelerator are the machines that we use today to deliver radiation treatment. Yeah. Historically, most of the radiation was delivered with radiation sources. So these were radioactive materials that were either temporarily or permanently implanted into patients or used in conjunction or in close proximity to the patient to deliver the treatment. What the linear accelerator allows us to do is to actually create a radiation beam and to shape and deliver that radiation beam. And that technology came around in the 60s, and the Elliot Hospital is one of the first 4 cancer programs in the world to have a commercially available linear accelerator.
Really?
Yeah. So the original benefactor of the cancer program was Mr. Amon, who was influential in the Manchester community, helping to set up the Manchester airport here. He had to travel down to Boston, and as part of his cancer treatment, and he wanted to make sure that others in our community didn't have to didn't have to do the same
Travel
thing
as
that he
far,
did,
right.
travel as far. So, pardon me. So he was the one who actually donated the money for us to acquire that first linear accelerator. And so we always say that we were on par, if not ahead of Boston in terms of where we were in terms of the technology. And I think we've always prided ourselves that we've always tried to stay on the cutting edge.
Yeah.
So we've started programs here that many of these programs, we were able to do these even before the Boston programs were able to do that in terms of stereotactic treatment.
Mm-hmm.
So we started a very robust stereotactic body radiotherapy treatment, which allows us to give very high-focused radiation therapy in a very short period of time. And it's really revolutionized how we deliver treatment. So
Why is that important?
So historically, radiation treatment usually took weeks to deliver. It was delivered typically, and it still is, it's delivered on a daily basis for the majority of patients. Yeah. But what's happened over the past 30 years is that treatments have gotten shorter and shorter because the technology has gotten better. So what that allows us to do is to give more concentrated treatments in a shorter period of time. So it allows us to give a little bit more punch to the treatment. I mean, it's more effective, but it's also more convenient for the patients as well. Instead of having to come in for treatment for 9 weeks daily, and you're trying to maintain working and paying bills and living and raising a family and being able to condense treatment to shorter periods of time has been life-changing for patients. But then we also recognize that with the technology that we have, that it's more efficient. We do a much better job of targeting treatment and sparing other areas which don't need to see the treatment, to spare those from the radiation treatment field. And so what that allows us to do is to concentrate the treatment. So we've been doing these treatments actually for about 20 years. In conjunction with that, we were also one of the first programs in New England, one of the first hospitals in New England to start lung cancer screening. And so we recognized very early the importance of lung cancer screening. New Hampshire, we had one of the higher rates of individuals being diagnosed with lung cancer at an advanced stage when the treatment's not as successful. And so the idea behind lung cancer screening is that in any screening program is that you want to diagnose and start treating a cancer at an earlier stage. And that's what lung cancer screening has allowed us to do. Yeah. And in conjunction with the lung cancer screening program, many of those patients are treated either surgically or with these high-focused radiation treatments where we're able to do this in a short period of time. And it works really well for individuals who are not surgical candidates. They have other medical issues that they might not be able to undergo a large lung surgery. That those individuals can be treated with these very short courses of radiation, which are just as effective as surgery, but doesn't have the invasiveness of a surgery if those individuals can't tolerate that.
Yeah, I was fascinated to learn that. I think the average lung cancer screening rate for patients who are recommended in many health systems is only 10%.
Correct.
And I know Dr. Holly Mintz, our chief medical officer, and Marcia Clemens, our executive director, are massive champions of lung cancer screening. And if I'm not mistaken, I believe the Elliott's rate of lung cancer screening for patients who are meet the guidelines is just surpassed 60%, which is
phenomenal.
Kind of off the charts.
It's phenomenal. Correct.
And I think that focus and really the opportunity to keep cancer care local and convenient has been a driving element for our cancer center, the Solinsky Center for Cancer Care. So tell us a little bit about the technology that you've seen in the last few years, because I understand that Elliot has invested in some of that technology and hopefully the opportunity for you to provide those therapies to help change patients' lives.
Right. So probably the biggest advancements that we have are twofold. One is the machines that we use, and second is the software that we use to run the machines. Okay. So the machines, as I said before, these are linear accelerators, and those have advanced tremendously over the past 20 years. So just to give you a sense, the machine used to be fixed, so that means that if a patient needed treatment from front to back, that we actually historically had to rotate the patient. Now the machine rotates in 360 degrees around the patient. Oh, the table that the patient is on, as we call it, it has 6 degrees of freedom. So it's like an airplane. So an airplane can move in 6 different degrees of freedom. So that the table that the patient's being treated on, in conjunction with the machine, that we can get the patient and the area that we need to treat to line up with the treatment machine within millimeters or less of accuracy. And that can happen almost instantaneously. So these treatments in the past would have taken us, when I started, 18, 20 years ago, these treatments took 30 minutes to deliver. And most of these treatments today, these very sophisticated treatments, take about 2 minutes to deliver,
Wow.
just to put it in perspective for you. So that's great in the sense that it minimizes movement, but it's also a patient comfort issue.
Sure.
You can imagine being in an uncomfortable position for 30 minutes, not being able to move, feeling like you need to scratch your nose and
Right,
that kind
right.
of thing. So the treatment's done very quickly. So it adds to that, to the accuracy of the treatment, that we feel very confident where we're treating. But it's also a very quick treatment as well.
I would imagine with the advancements in the technology, it's great that the Elliot has been there, I think, to help.
Oh, yeah.
And we'll talk a little bit about the philanthropy, and
Yes.
'cause these units are not, they're relatively expensive, as they should be, to
Correct.
deliver excellent care.
Correct.
But I would imagine that your training and to keep up with the technology, it's pretty demanding. How do you do that?
It is. So there's so we have continuing medical education. We work with the vendors that build and update these machines. So we have constant education and upgrades. But probably most importantly is that what patients don't recognize is that we have a whole support staff behind the scenes. We have a whole physics team. So we have PhDs in physics and individuals that have trained specifically in the physics of designing and delivering radiation therapy, and the QA, the quality assurance that goes into making sure that when we deliver treatment, that we feel confident that we're giving the best possible treatment, and maintaining the machines and making sure that the treatment that we're intending to deliver is actually the treatment that we're delivering.
This is truly team-based care.
Correct. And
you
so patients might not see that, because a lot of this is happening, at the end of the day. So after patients have had their treatment, there's work that's going on during the evening hours in terms of creating treatment plans, making sure that those treatment plans, every treatment plan is, these sophisticated treatment plans are test runs, so to speak, to make sure that they're being delivered exactly as we intended. So all of this is happening kind of after hours and behind the scenes, so that when the
Wow.
patients come in for their treatment, this all happens seamlessly. Yeah.
You truly are the quarterback of this kind of cancer care delivery that we have, and from everything that I know we've heard, you have a Tom Brady-like reputation with patients.
Well, it's a
that
team.
have,
This is a team approach. So
Yep.
we work with absolutely wonderful individuals. So the majority of when the patient comes in for treatment, they are cared for by a wonderful group of therapists, radiation therapists,
Yep.
and our nursing staff. And so the therapists are the individuals that are actually administering that treatment on a daily basis. I'm overseeing that work to making sure that the treatment's being delivered exactly as I intended. But those therapists do a wonderful job of not only delivering high quality care, but they're just such compassionate individuals. They know those individuals, they know their families, they work around their schedules. They'll come in early, they stay late in order to help accommodate patient schedules to make sure that patients are getting their treatments. And just basically providing that emotional support, because it's scary. Most individuals, fortunately, don't have any experience with radiation therapy.
Right. What are we gonna expect?
What to expect, and radiation kind of has some scary connotations associated with
Yeah.
it, and our nursing staff and therapists really do a great job of trying to calm the patient down, to walk them through each step so that they know exactly what
What
to
they're gonna
expect, what they
experience.
expect, and what
Sure.
to experience. And I will say that every patient, by the end of, and that's not an exaggeration, they will thank me for the quality of care that they've received from the therapist and the nursing staff, and what a great job that they did to put them at ease throughout the course of their treatment, and knowing that they really got the world-class care here, but they felt that they weren't just a patient, but they were an individual, a friend, and a family member that were being treated in our clinic.
That kind of brings us to the topic of managing the patient holistically. And cancer treatment affects not just a patient's physical body, but also their mental health and their spirit. What are some of the common needs that you see that arise alongside the treatment regimen? And how do you direct patients to those resources outside of the standard medical or
Correct.
physical treatment?
We are so fortunate that we have such a great support staff. Besides the medical support staff, we have a wonderful group of individuals that help to get patients through treatment. We have a very robust social work team, and every patient who walks through our doors meets with a social worker. Whether they think they need to meet with a social worker or not,
Really?
everybody meets with a social worker, just to address to see, is there anything that we can do to help, whether that's with helping to arrange for transportation, leave of absences from work, helping with childcare. They help with the insurance component. So I think that is tremendously helpful, and probably might be just as helpful as all of the biology and the technical aspects of treatment, is to make sure that those needs are being met as well. Because if you can't physically get a patient in for treatment, then you can't treat them. And so that can be just as important as having the state-of-art treatment machines and the best physicist and the best treatment planning capability. You got to be able to meet patients at their level, make sure that they're able to get in on a daily basis, and that they're able to continue with their lives as well. They've got to be able to work and raise their families and continue living their lives. So basically recognizing that's part of our job too, is to make sure that individuals keep living their lives during and after their cancer treatment.
Sure.
So we have social workers, we have dietitians. At the Elliot Health System, we have wonderful occupational and physical therapists that will jump in immediately. So if individuals are having side effects related to either surgery or radiation or to their chemotherapy treatments, they jump in and are able to help those individuals get back to where they were before we started with their treatment, which is a tremendous resource. And they bend over backwards for our patients to make sure those patients get in quickly, because they recognize that if they're in pain or if they're not able to complete or participate in their treatment, again, we're not accomplishing our goal. And so that oftentimes can be just as important as the radiation we're delivering or the chemotherapy drugs that we're delivering.
That's great that, we talk about, I have the luxury of working with some wonderful leaders with the Elliot Health System's leadership team, particularly Dr. Baxter,
Right.
our chief executive officer, and others. And one of our focus areas has been to, we want to make sure that we provide access to local care. And we really want to try to provide comprehensive, coordinated care that's really high quality, and that we understand access and being able, you don't have to go to Boston to
Correct.
seek this care. And so to have that wraparound services, it's great to hear. One of the services that we've looked at developing over the last few years has really been a focus on behavioral health.
Mm-hmm.
I would imagine, given the complexity, some of the challenges associated with navigating a cancer diagnosis, that there are occasionally the need to tap into those services.
Oh, definitely.
How does that work from the Cancer Center?
So our social work department plays a huge role in this.
Okay.
So these are individuals that are trained in counseling, but also recognize that they're able to get other resources if we need other resources for our patients that go beyond what we're able to provide in our department. So it's great to be able to recognize when we need those services and be able to pull those services in, and then be able to have those services already in-house. They're under our roof. So if someone needs a higher level of counseling or a higher level of mental health assistance, we're able to do that. And it's not going to get in the way of their treatment. We do that in coordination with their treatment. Because again, if you're not able to meet the patient where they're at, then you're not able to deliver the treatment, then you've not accomplished your goal.
Wow.
Yeah.
In looking at that and managing, we've talked a lot about managing the patient,
Mm-hmm.
but one of the consistent themes through our episodes has been, it's not just the patient that is participating in the care. It is the patient's support system,
Mm-hmm.
loved ones, caregivers. How important is it to have resources and support for their team, their care team,
Correct.
their loved ones, and how do you navigate that, and how do you manage that within a cancer
We
system?
really encourage that when patients come in for treatment and they come in for their consultations, they bring their family members in so they know exactly what we're going to be doing and be able to pull in all the available resources that we're going to need to get them through treatment. Whether that's the physical component of helping administer medications and making sure their dietary needs are met, to transportation, getting them to their appointments, and just helping to coordinate all these moving pieces. So you can imagine not feeling well, being completely overwhelmed with a diagnosis, and then having all of these, trying to navigate all of this. It can be a bit much. So we really try to pull in family members. And if there are situations where we don't have as much family support as what we like, that's when we're pulling in our social work departments and all of the other resources that we have at the Elliot system to make sure that we have the community volunteers and other the resources in the department to make sure that those patients' needs are being met and that they're able to get where they need to be on a daily basis, and that that their symptoms are being addressed. If they're in pain, their pain's being addressed, and that's crucial. So we really try to pull the patients' families in, and that's why it's so important to build that bond, not only with the patient but the patient's family. And we become so close because it really becomes a team effort. To get a patient through treatment, it really becomes a team effort. Yeah,
it really does. We had the luxury of meeting with Leanne a few episodes ago, and learning about some of the connectivity to our support teams. And even though she experienced a loss of her loved one after the cancer journey, the amount of support, benefit, comfort that she received from the support group, understanding what the cancer care would look like, and the notebook that she had in terms of understanding what do I need to be prepared for, really hit home. I know I had, like many of us that work in healthcare, we've been touched by cancer diagnosis.
Right.
And, I think about a journey with my loved one and didn't have access to that. And it would have been wonderful to understand, that's how this is going to go.
Right.
This is who I need to make sure that I contact. And just, I think that connectivity and that community that we build, it is a team and then some.
Definitely. When patients leave our consultation or leave, the thing that we really try to emphasize is you have the contact information. So when you leave, you know who to contact with your questions. You know where you're supposed to be next. We really try to make that coordinated. So no one gets out into the parking lot and they're like, well, what's that next appointment? Where am I supposed to be next? They know exactly where they're supposed to be every step of the way. And if they've got questions, if there's bumps in the roads, then they have that card of that individual to say, okay, this is the individual I'm going to call if I need help, if I need to reschedule something, or I haven't heard from this office, or I need, I need this study to be done instead of this study. It's nice to know that when you leave, the physical confines of our department, we're still there with you. You know how to reach us, where we are, and how to, and where you need to be. I think that's the most important part. Kind of what's the next step.
Yeah, that's what we want to be for the community.
Yeah, definitely.
We talked a little bit about the evolution of technology and the services. How has the services and the things that you've done changed the expected lifespan or survivorship? What have you seen in your career in terms of the impact of your services and as we pull these things together?
So we've really seen cancer become a chronic disease for many individuals. So when I started my training, individuals who were diagnosed with more advanced cancers were often told that these cancers were life-threatening, and that expectancy was, their life expectancy was limited. That's changed completely, and we're very cautious in terms of in terms of trying to predict and trying to give numbers and so forth, because what we've recognized is that there are so many new options and treatments available to us that individuals are living with cancer like they're living with diabetes or heart disease. We have new medications, and I always say that even in a situation where we might say the cancer, we can't get rid of every last tumor cell, but we certainly have treatments and treatments after those treatments
ways to manage it
and to keep this cancer in a state of control. And that's really the biggest change that I've seen during the past 20 years, is that mentality has really changed.
It really has.
Yeah, and it provides optimism and hope to recognize that there are new treatments down the line. That if this treatment stops working, we've got not only one other treatment, but two other options after that. And I always try to impress that upon patients, that if this treatment doesn't do what we need it to do, this is our plan B, this is our plan C, so that they know that we have other options available to us, and this is our game plan moving forward. so that we're not just looking at just the right here, we're looking at the future as well.
How do you see that cancer care evolving here at the Elliot? What are some of your visions or thoughts of how we might continue that journey to make it manageable?
Yeah, so I think, for us, it's just having access to the technologies, to the medications, and then having the education, the resources to apply these to patient care. As I said before, we are very fortunate to be in the greater Boston area, so we have access to the education and to these resources when we need them.
Sure.
And so that when we need to expand programs and we need to offer these treatments, these cutting-edge treatments to our patients, that we have the resources to do that here locally. And so it's not like we're just practicing in a vacuum, that we have these resources available to us, which is really nice to know that our programs are always expanding, evolving, and we're growing. And we're not just doing that in a vacuum. We're doing that with the support of not only the greater Boston area, but nationally and internationally, to making sure that we're incorporating these newer treatments and the cutting edge treatments into the treatment plans for our patients here in the community.
Great.
Yeah.
When we were talking a little bit about some of the coordination and other pieces, you mentioned a critical word within cancer care and what we do at the Solinsky Center for Cancer Care, and that is trying to promote and inspire hope. And this podcast series, one of the things that we're hoping to do is to call awareness to some of the work that we do, and supporting one of our endeavors, which is the Walk for Hope.
Right.
What does philanthropy mean, and how is that important to you, your role, and our ability to continue to evolve and deliver and support our patients?
To me, the main purpose of philanthropy is community involvement, is to get our community involved in our cancer program, to recognize what a gem it is and what a resource we have right here in our community. And that's really what I think philanthropy does. Yes, it's nice to be able to have the funds to grow and expand, but it's really to make the community recognize what services we have here and what our goal is and what our mission is to provide care and compassion for that individual. And I think that's really the purpose of philanthropy, is really the community involvement. And there are many ways of doing that. And one of the byproducts of philanthropy, yes, is it's great to have the financial support of our community as well. But oftentimes support comes in the way of emotional support and any other resources that individuals can provide us to provide better care for patients. So I think that's it's really the community involvement. That's what the purpose of philanthropy is.
Yeah. It is. I get to see it at some of these events, whether it is the Walk for Hope, whether it is different functions that we have, galas, outreach, you name it.
Right.
The support that we have and the opportunity to keep that care local is massive, and I think it's a great opportunity to help support some of those services.
I mean, most of these philanthropy events that we have, they're celebratory.
They are.
We're recognizing individuals that have, gone through something very challenging or going through something very challenging. And for those individuals that weren't as fortunate, we're honoring those individuals and celebrating their lives and the impact that they had on us and our communities.
I was blown away when Marcia and Kristen Jordan gave us the information on all the different events that we have, whether it's related to breast cancer survivorship, other, programs. And it underscores, I think, the point that you made, that we are seeing through the growth, the development, and the strength of our services, moving cancer diagnoses to chronic disease management.
Right.
And how do we help promote that survivorship? I mean, we've seen it. You mentioned our physical therapists and that team. Their opportunity to move away from just short-term planning to, we're going to need to build up strength and continue to work, because you're going to be able to
That's exactly right.
live with this.
That's exactly
which
right.
is a great problem to work on and to help solve.
Definitely.
If you had one piece of information that you wished more of our community members knew about in relation to cancer care or the Solinsky Center for Cancer Care, do you have a piece of information or something that comes to mind that you would like to share with us?
I think it's really just compassion. I think that when you walk through our doors, that's the first thing that from our front desk staff to the nursing staff, to the physicians, to the therapists, to the individuals that are administering these treatments. It's really compassion. We are here for you. We are here to provide you the best possible medical care, but also the best emotional support that we can to get you to the point where you're back living your life and continuing living your life and doing that respectfully. And I think that that's really, that we don't treat individuals as just a number or a patient. We look at you as an individual, and what are we going to do to get you back to where you were or to get you to the point where you need to be. And I think that that's the heart of our program. It's just truly just compassion for the individual.
It sure is. And I think, that's exactly what our vision and mission had been in terms of pulling a lot of these pieces together. And I know you embody that from the conversations that we've had with patients, with team members, and on behalf of the Mary and John Elliot Charitable Foundation, the Elliot Health System, and the Solinsky Center for Cancer Care, I'd like to thank you for participating in this today and the work that you've done with us.
And thank you for supporting us. And, the administration at the Elliot Hospital is phenomenal in terms of what you provide us, what you provide our programs, and what you provide our patients. And it shows, and we are extremely appreciative.
It's a pretty special place.
It is.
It's an honor to carry on the mission of Mary and John Elliot.
Couldn't agree more, yeah.
With that brings us to a close of the episode. Thanks again.
Thank you for having me. Yeah.
We look forward to seeing you next time.
Great.
Thank you.
Great.